Ready? Mic check. 1, 2. Levels check. 3, 4, 5, 6, 7, 8. This is an audio check for the levels of the media box. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 1, 2, 3, 4, 5, 6. Good.
I think it's me, you, and Paul. Eric? Do you have anything to present? Boost? Okay, you're after Paul. Yes, sir. And then it's just
They give it the card. Okay.
So green is on. Check. That's all.
We're good? I don't see Laura. There's Laura. Good? Okay. All right, good afternoon, everyone. Thank you for being here. We hope you all have had an enjoyable Thanksgiving with your family and friends. We have just celebrated one major holiday, and now the winter holidays, including Christmas and New Year's and Hanukkah holidays, are fast approaching and already here. We want everyone to enjoy the winter holidays with your loved ones and to do so safely amid the ongoing COVID-19 pandemic. Before we share with you some things that you can do to celebrate the holidays safely and to minimize your risk of COVID infection, I will provide an update of the status of the pandemic in Bexar County. Let me first start by noting how far we've come this year from the same time last year. During November 2020, our community was in the thick of another surge of COVID-19. I think you remember it well. This time last year, our positivity rate was roughly 9.2%, and our incident rate of cases was 38.6 cases per 100,000 population. And our hospital admissions at that time were 582, and then we're beginning to overwhelm our entire hospital system. COVID-19 vaccines were not yet available to the residents of San Antonio or Bexar County. Now, fast forward to November 2021. I think we can all agree that we have indeed come a long way, and we've made some great progress together, and that is to the credit of our medical professionals, our first responders, people in the services of all sectors, and of course, every single neighbor who has been taking this pandemic seriously. In December, late December 2020, we started offering the Pfizer COVID vaccine to our residents at our mass vaccination sites in Bexar County and San Antonio. Today, the city of San Antonio and Bexar County offers the Pfizer, Moderna, and Johnson & Johnson COVID vaccines free through our weekly pop-up vaccination clinics in neighborhoods, so that our vaccines are easily accessible to all residents, especially those in traditionally marginalized community. And we know there's pockets of those areas all across our city, but especially in the west side, the east side, and south sides of San Antonio. Today, we're providing the Pfizer, Moderna, and Johnson & Johnson booster shots to all residents 18 and older in accordance with the recent recommendations by the Centers for Disease Control and Prevention. And we're now providing the COVID vaccine to children ages 5 years and older. We know this is welcome news for many parents who have been waiting for that for a very long time. This is all good news, but we also don't want to get too far ahead of ourselves, because we don't want to let our guard down knowing that we aren't out of the woods just yet. Now for an update on our progress and warning indicators. As of today, our positivity rate has increased to 4.8%. That's up from 1.8% last week. The incidence, and this is an important one, the incidence of COVID-19 cases is 9.5 from 8.8 last week per 100,000 population. It's important to note, and Dr. Jacob is here to get a little bit more in depth about this, but it's important to note that the new positivity rate most likely reflects the small number of small number of tests conducted during the holiday week. Many testing sites were closed last week, and we performed a fraction of the tests compared to the previous week. Our risk level overall, which is again a good gauge on all the different indicators that we track, our risk level overall remains low for the 5th week. Our 7-day average is 165, and our number of new cases was 198. That's the latest reading today. Our cumulative case total is 327,592. And our cumulative deaths, and again, these are more than just numbers, these are loved ones that all of us have been dearly missing. We have lost now 4,950 San Antonians, beloved to members of our community. Although our risk level is low, we continue to report new cases of COVID every day, and individuals are still being admitted to the hospitals, and that is, of course, placing stress on all of the medical provisions of our community. This is why we've gathered together today to remind our community to not let your guard down, number one, as we prepare to celebrate the Christmas and New Year's holidays. First, the best way to minimize COVID-19 risk and to celebrate Christmas and New Year's holidays with your family and friends is to get vaccinated. This can't be stressed enough. That's a level of protection not just for yourself, but for our entire community. You can go to a COVID drive-through clinic, and those are available. I will recommend also the Alamo Dome, which is open from noon to 8 p.m. Wednesdays through Fridays. No appointment is necessary. No cost or insurance needs, no money or insurance needs to be provided to get that shot. You can also visit covid19.sanantonio.gov for a list of Metro Health vaccine pop-up clinics near you, or call the COVID hotline, and that's simply dialing 311 and hitting option 8. During the winter holidays, it can be challenging to avoid crowded indoor places, especially when you're out getting your holiday shopping done. So regardless of your vaccination status, it is always a good bet, and we encourage you to wear a mask in crowded settings because the person next to you could be unvaccinated or could have COVID, or frankly could be vulnerable to catching COVID, and we want to look out for them as well. They might not know if they are asymptomatic, and you can be sick and have symptoms as well, and we encourage you in that case to stay home. You certainly don't want to host or attend Christmas or New Year's Eve parties if you are symptomatic and therefore can spread very easily to other people. Finally, get tested if you have symptoms of COVID-19 or have close contact with someone who does. For a testing location, you can find those at covid19.sanantonio.gov. And again, thank you all for gathering together. We have not been on the air as we had been throughout the pandemic, but please know we have our eyes on the ball, and we encourage you to do so at the same way. Please keep your guard up. Let's enjoy the holidays together, and let's put this pandemic once and for all behind us in 2022. So let me turn it now over to Judge Nelson Wolff.
Well, thanks, Mayor. We're pleased to see that a lot of parents are having their children vaccinated, and that's really important. We've shown that the Pfizer vaccine is about 90.7% effective in children from age 5 to 11, and we know that if they're not vaccinated, they can very easily pass that on to someone else at school, or can pass it on to their parents or to their grandparents. So it's important that we continue to push getting vaccines into the arms of our young children. At the Wonderland site where we have the Bexar County Hospital District operating, we've done 7,000 shots at that location already, and we're starting the second dose, starting yesterday on the second dose. So we'll continue to see more and more children come in and get their vaccine. It's extremely important that parents also step forward and do that for their children. We are doing good, I guess you'd say. We're in a low zone, but we're moving around a lot more. I think Tracy and I have probably been to 20, 25 different social gatherings in the last 45 days or so, and most people are not wearing masks all the time, including me on some of the events too, where we have a chance to spread out. But I think we're going to have to be a lot more careful about that in the future. And Dr. Jacob will talk to you a little bit more about this, but we know what's happening in South Africa and how it's also spread to some other areas. A new variant called Omicron that is beginning to get spread around, and you've seen the decisions by President Biden and other political leaders of restricting flights in between various different countries, and taking that action early on instead of delaying it so long as we did when COVID started in its initial stage. So this variant, again, can spread easier. We don't know how destructive it can be, but when the World Health Organization stated that the global risk was very high and stated that it could lead to surges with severe consequences. So we're hoping they're wrong. We're hoping that that does not happen. But if it does, and we continue to hover around 25% of people that are not vaccinated, we may brag about our 75, but that means 25% are not. That means 2 million people are in San Antonio. That means 500,000 people are not vaccinated. They will drive another pandemic for us if this were to come. And so we've got to convince them to get out and to get vaccinated. Just because you had COVID before, do not think that would necessarily protect you. The antibodies are not as protective as the shots would be and the booster shot would be. So we're going to continue to push adults to get vaccinated. Mayor stated 18 and older. We've done 25,000 adult vaccinations, the boosters at the Wonderland site so far, but we need to do more. So important to get that booster. We didn't think it was so important just a little while ago. I think the CDC was recommending people 50 and older or people that may have health conditions. Not anymore. They're recommending anybody 18 and older, go get the booster. So we really, really want to encourage you to do that. We are working good. We've had a little bump in hospitalizations. In the last 17 days, we've gone from 133 up to 185. It's not a dramatic increase, but one that we want to bring down the other way and go down rather than easing back up. For those that do get sick, and those that are 80-some-odd% of you are unvaccinated, the Fusion Center is still operating out at the Bexar County grounds at the Expo Hall. And if you make an appointment, you can still go there. During the early stages of this, we were doing about 140 a day. Now we're doing about 45. So that service is still available to you if you did pick up symptoms and you wanted to preempt and hopefully that you wouldn't have to go to the hospital. So let's just be a little more careful, including myself. I need to be a little more careful myself and wear that mask more often than what you would like to. I don't like to wear the mask any more than anybody else does, but we're going to have to start being a little bit more careful as we move forward. Dr. Claude Jacob is going to explain to you a little bit more about what's happening and talk to you a little bit more about the Omicron.
Good afternoon. I'd like to thank the mayor and the judge for the opportunity to provide this important reminder to residents as we prepare for the holidays. It's great to hear the progress that we've made since November of last year, yet we must remain vigilant in the weeks ahead. So yesterday, the CDC announced that it is strengthening its recommendation on booster doses for individuals who are 18 years and older. Everyone ages 18 years and older should get a booster dose either when they are 6 months after their initial Pfizer or Moderna series or 2 months after their initial J&J vaccine. As you've heard and as we know, the COVID-19 vaccines continue to be highly effective in reducing risk of severe disease, hospitalization, and death, including against the Delta variant. We also were looking at CDC data that show that back in August, the risk of dying from COVID-19 in the U.S. was more than 11 times greater for unvaccinated individuals than for fully vaccinated individuals. So why we're here, again, as you've heard from the judge, we know that many in our community have been hearing about the new Omicron or B.1.1.529 variant, and I want to just share briefly with you what we know so far. So according to the CDC, the recent emergence of the Omicron variant further emphasizes the importance of vaccination, boosters, and prevention efforts needed to protect against COVID-19. Again, the early data from South Africa suggests increased transmissibility of the Omicron variant, and scientists in the United States and around the world are urgently examining vaccine effectiveness related to the variant. The CDC also strongly encourages, again, the 47 million adults who are not yet vaccinated to get vaccinated as soon as possible and to vaccinate children and teens in their families as well, because strong immunity will likely prevent serious illness. The CDC also wants to encourage people to get a COVID-19 test if they are sick. Increasing testing will help us identify Omicron quickly. So while no cases of the variant have been detected in the U.S. so far, we can expect to see some cases fairly soon as this situation evolves around the globe. What we have seen over time is that the strength of the vaccination against Omicron isn't yet known, but it is still likely to be at least somewhat protective. So why we're here is that it's a good time to get vaccinated and not too late to get your booster shots. Our Metro Health team encourages all eligible residents 18 years and older to get vaccinated as well as the booster shots. Again, you can visit our Alamo Dome drive-through clinic or one of our pop-up clinics which offer the Pfizer, Moderna, and Johnson & Johnson booster doses. We've made great strides to make the vaccine available to residents, and I really want to thank and applaud my fantastic team at Metro Health and our incredible community partners for helping to get shots in arms over the course of this year. Keep in mind that still, more than 1 in 3 San Antonians is not yet fully vaccinated, which is the reason why we wanted to at least share today's reminder about taking added precautions during the holidays. So a decision to vaccinate or not vaccinate doesn't just affect you. We are all connected in one form or fashion. So do it for yourself, do it for your family, do it for San Antonio. I'll now ask Eric Epley, Executive Director and CEO of the Southwest Texas Regional Advisory Council, to the podium to provide an update regarding our local hospital systems and our current plans in place.
Thanks, Claude. Greetings. Good news from the healthcare systems. We're at 184 COVID patients in the hospital right now. I want you to think about this from just in August, not that long ago, just a couple of months ago. August 23rd, our peak was 1,466. Today, we're at 186. So while we've seen a mild increase just in the last 4, 5, 6 days, relatively speaking, just a couple of months ago, we're drastically in better shape. The incidence of COVID in the hospitals right now, 5.2% of patients in the hospital are COVID positive. We had 31 new admissions yesterday. 65 in the hospital in ICU, 29 on ventilators. Those numbers, again, in August, were 412 in ICU and 279 on the ventilator. So again, good news with the healthcare systems. At that time in August, we had 106 extra staff from the state, contract nurses from the state of Texas. Today we have 96, and by Friday we will have 0. So again, good news on the front from the healthcare systems. Another good piece of information, the hospitals are seeing really mild flu, mild RSV, which is the other virus that tends to come around about this time of year. So in all, very good shape from the healthcare systems overall. Thank you very much.
All right, well, I want to thank our Metro Health Department. We do have Dr. Kurian, I see here, as well as others from the Metro Health. We have Mario here. Of course, Dr. Jacob, myself, the judge, Eric here for questions. I also want to thank my colleagues from City Council here. I see Council members Cabello Haverda, Rocha Garcia, and Courage are all here as well. So at this point, happy to take questions. Then when we wrap up with that, anybody's available for individual interviews.
Is there any particular age group that's under-vaccinated? Or what's our lagging group, I guess you would say?
Age groups.
Thank you for the question. So we've done a fairly decent job getting the different age groups vaccinated. We early on had concerns about the 19 to 29-year-olds, but I got to tell you, since September, you may recall, we rolled out this HEB incentive program. So we've done a very good job, at least incentivizing the reason for getting vaccinated. Again, I can't thank our community partners enough for getting the word out. We've tried as many different outlets, whether it's social media or PSAs or billboards or radio ads. So really getting to certain demographics, and we've seen that change over the course of time. And we focus on the higher need areas across the city.
With the diminishing of the cases so dramatically in the last months, how good was a tracking system here in town, and if at the end of the day was something important to do it?
So if I understand the question correctly, in terms of our ongoing surveillance systems, so
The tracking of the people that was getting infected. And, you know, at the beginning, there were not enough people, and then even the city was asking for people to help us, you know, with that trackers. Was that important? And at the end of the day, being how we are right now, with low cases, how important was, or how important is it?
yeah, thank you for the question. So in terms of the contact tracers and our staff on the ground, yes, we've worked with our academic partners, our healthcare partners, in order to do a better job to make sure that we follow these cases systematically. So it was important. We learned a lot. We've adjusted. And as you've heard from at least our healthcare partners, where we saw the need to have added support, like nursing staff, we put in the requests, and it's helped us to at least make sure we stayed on top of these cases. So the message is still clear. It's not just chasing cases, but it's also ensuring the message around getting vaccinated, getting tested, and that we've done very well here.
Now, how important is to still get tested?
Just as important, again, right now, as you've heard, because of the new variant, we do want to make sure that folks get tested. We are asking, and we are working with our federal partners as well as our area labs to make sure that we do the genomic sequencing. So we continue to require that, and it is a free service that we are offering to residents. So just know that that isn't just as important as it was at the start of this.
A lot of people are saying they feel very similar to how they felt. A lot of people are saying they feel very similar to how they felt in December 2019 when they first heard about COVID-19 with this new variant. How are you guys keeping them, calm about this? Because last December, as we're all aware, we saw a very big spike right after Christmas and New Year's.
Yeah, what a difference a year makes. Just keep in mind that this time last year, we did not have the resource that we have today, a vaccine. So just know that why we've been messaging this over the course of the summer and through the fall, that the pandemic that we're seeing out there is amongst the unvaccinated. So the game changer has been having availability of vaccines, and the announcement by the CDC yesterday was to make sure that folks get their booster shots, and adults, again, 18 years and older. So that's the game changer, is that what we didn't have last year this time.
Last December, there was the emergence of the Delta variant. Now we have the Omicron variant, and we saw a surge last year. Does that create a feeling of uneasiness going into the city's monitoring of our current cases, monitoring for a possible surge?
If anything, we're applying lessons learned from last year, right? So we remain vigilant. We stay on message, and that's what we've been encouraging residents to do. The good news is that different from this time last year, we have vaccines. So it's a different strategy. We're encouraging folks to get vaccinated, but we remain vigilant, and that's why we're reminding folks with the holidays, with travel, with the COVID fatigue, with the malaise, with folks really trying to let their hair down. We want to make sure we remind them, just like you wouldn't cross the street without looking both ways, we must remain vigilant through the holiday seasons.
We see some of the council members here who have been pushing for vaccine equity across the board. I know that was a big thing, being able to close the gaps of technology, language, ability to get there. We saw the big pop-up clinics that happened with WellMed Partners. Is that going to be available again? Should we need to get more people in for boosters? I know we have HEB, CVS, and all the partners, but is that potentially on the table?
So if I understand correctly, so addressing the disparities amongst different communities. So I would say that we've applied different tools. We use different indices, so an equity index, a COVID-19 equity index. So we've been able to identify the areas of highest need across the city, and we've shown at least the change over time. Different vaccination rates, say in the summer to where we are now. So we're throwing everything at this, but just know that we have different tools that we've been using in concert with our area partners and area providers.
Can you talk about the parts of the campaign that are trying to reach school-age children and their parents?
Sorry, I didn't hear that.
Can you talk about the campaign that's to reach school-age children and their parents?
Yeah, so again, for the last couple of weeks, this has been the last step to make sure that those 5 to 11-year-olds are eligible to get vaccinated. So in the spirit of the holidays, we're having a little bit of fun at this. So we're at least making sure that we message this a little differently, that we make it a little bit more kid-friendly. So that's what you're seeing here. So if you want to wear a Santa hat and at least demonstrate that you want to get your COVID vaccine, we invite you to do that. But literally, it's customizing our messaging so we can at least resonate a little bit more with kids and with parents.
Mr. Epley, is the number 184 COVID patients in the hospital or 186?
It's 184 today. Yeah, I think it was 184.
I also have a question for you, Eric, so sorry. I just wanted to double check. You said that there were 106 at our peak staff, contracted nurses from the state.
806.
806. Oh, that makes so much more sense.
Yeah.
Okay, 806.
If I said 106, that was my bad. I think I said
No. I think I heard you wrong. 806 staff from the state that were contracted nurses because we had a shortage, right? And then today that's 96.
Right.
And it's going to be 0.
by Friday.
Okay, so.
Last shifts are Friday.
Okay, how did that, decrease happen? Was it pretty sudden, or was it like kind of ticked down
No, it's a
slow?
structured program. We've done this twice now, right? So the state monitors the amount of COVID admissions and percentages, and then says, okay, it looks like we're about ready to start decreasing this, and we put a plan in place with them and say we'll decrease by, I think the first one we did was 10%. The second one's been 20%. So it's a negotiated rate that we can all work with our healthcare system partners. We don't want to pull the rug out from the hospitals, but at the same time, we've learned and we're better and faster this time. So we did it in 20% increments and come down. And so this is our last big drop this week.
Is there a threshold where we would have to request more nurses from the state?
I don't know there's a specific number. Usually it's multifactorial, right? So you're talking about the number of patients admitted, but it's also how many people were short, how many nurses are out sick, how many have left to go to other jobs or to other industries. So that it's a amalgamation of all those things to make a decision. We make the request, and the state evaluates that, and then we find out if we're going to get them or not.
When looking at this new variant that we have and looking at our vaccination rate here in San Antonio compared to what we see in South Africa, there's a big disparity there in the number of vaccinations. Can we talk about how that might affect the transmission rate here with this new variant?
You're speaking to the fact that at least the larger subset of the population in South Africa is unvaccinated. The take-home message is still the same, that this is a pandemic amongst the unvaccinated, and it does have implications for how we respond to this new variant. So the algorithm's the same. Right now, we're doing the best we can to message this. That's why we're taking this time today to remind folks. It's nothing new in terms of our strategy, but it is to remind folks in the spirit of the holidays, take added precautions, vax up, get your booster shots, mask up, and celebrate safely.
And a follow-up question to that, are we able to get past this pandemic if we still have more than 1 in 3 San Antonians who are unvaccinated?
I am a perennial optimist, but I'm a realist as well. Just to say that this is with us. You hear more talk about this being endemic. So we're trying to adjust our routines. And just like this time last year, we weren't even talking about a vaccine yet. Right now, we're talking about a booster, right? So this landscape keeps changing. Our agility has been our best asset through this over the last 20 months. And so we'll adjust as we need to. And we don't have a crystal ball, but we respond accordingly.
Now, this is for the hospitals. What has been the ratio? What has been the ratio of vaccinated and unvaccinated people that's still getting into hospitals? And of those 184 that you have right now, how many are with and without it?
Yeah, the vaccinated and unvaccinated in the hospitals right now is about 81%. A while back, it was about 90%. And so that's going to continue to decrease. The more people, you have to remember, the more people we get vaccinated, the more people who are going to be in the hospital are going to be vaccinated. I mean, at some point, theoretically, if you could actually get everybody vaccinated in the city, 100%, just say, for example, then anyone who went to the hospital would be a vaccinated admission, right? I mean, at some point, the scale's moving. The more people, in some ways, it speaks well that we're having a few more people, the percentages is changing to vaccinated, means our vaccination rate's higher. Does that make sense?
And
Okay.
the mortality rate has been changing because of that?
Lower.
Lower.
The mortality rate in the hospitals, it's lower.
Mr. Jacob, I've spoken to parents that are for and against getting their children vaccinated for COVID-19. What would you say to parents who are concerned about it still?
Over the course of the last few months, we've talked about the safety of the vaccine, the effectiveness of the vaccine. What you're hearing is a reality around the variants and why we must anchor to the science of the work to protect kids and adults. So to parents, we understand it's a personal decision, but at the end of the day, think about what we're sharing here, why we're sharing this. We're trying to stay on message. We already heard from the hospital system that those admissions are driven by those who are unvaccinated mostly. So we would just encourage parents, and if they need more information, check covid19.sanantonio.gov or reach out to any of us here on the panel.
And Mr. Jacob, the genomic sequencing. Hi. Sorry, I just wanted to ask if you could maybe explain. It's not like every single COVID test gets sequenced, right?
So I'm looking to Dr. Kieran, but just know this, that we do have the capability to sequence. We have the area labs. We have a contract with the University of Texas Health Science Center. The CDC conducts sequencing. The state conducts sequencing. But at the end of the day, we do know the subset of that represents what we see out in the pool of those tested. So at the end of the day, that's why the CDC is encouraging folks to get tested, but also that we can have the labs do the sequencing.
Last year during this time, we saw higher COVID numbers, but lower flu numbers. This year, we're starting to see the flu pop up more. It's becoming more of part of this conversation. Can we talk about how that factors into the city's response and trying to get people protected against that as well?
So same strategy. Just flu season, we remind folks to use cough etiquette, wash your hands, mask up, but we also remind folks to get the flu vaccine. So At the end of the day, last year was a quiet year, so anything that we're seeing this year seems to be an anomaly, getting back to some sense of normalcy in terms of the volume. But just know that there are other bugs out there while we're just talking about flu, but the same best practices to vax up, to mask up, that's how we protect ourselves. And regarding flu, we encourage folks to also get the free flu shot.
Do we know how many people have been vaccinated against the flu yet this year?
No, we don't know as of yet, but we can look that up for you.
Mayor, Judge, I know you guys have been in constant communication with the other large Texas cities as well as other large cities across the nation from March of last year until now. Has there been any conversation about the preparations that could go into place should Omicron pop up in the city, and if that help might be needed in other places?
I mean, it's largely the same as we were last time. It's that, number one, we're trying to get the messaging out about the importance of getting vaccinated. That's the big X factor that we didn't have last time, which is why we're here today. Frankly, the big message here, takeaway, is get vaccinated. If you've been vaccinated, it's been 6 months, get a booster. That's the message today. Use the tools that we have. I think that we also need to be aware that there's other viruses out there that can overwhelm our hospital system if we're not careful. So the essential element of all this is keep your guard up. We're not out of the woods yet. There's still a large portion of our population that isn't vaccinated yet, so every person that gets vaccinated is a little bit more protection for all of us. We're good?
What is the
All right,
percentage of people that is not vaccinated yet?
I think we're at 75%.
Unvaccinated, so it's about
Oh, okay.
30%, just about 30%.
You want to say that? All right, then
Sorry about that. Yeah, so we tout each week the percentage of the population that's been vaccinated here in Bexar County. So just know that about a third of the population is unvaccinated, so about 35% unvaccinated.
As in, like, no one dose at all? Like, they didn't even get it the first?
No, what we know is that 78% have gotten at least one dose, but we're also seeing a third of the population not yet fully vaccinated. So that's why we're staying on message.
So in lay terms, we're talking about how many thousands of people?
Yeah,
Well, 200,000?
it's a third of the population. I mean, just know that.
Do the math. Do the math. Thank you.
Okay.
question?
We keep talking about get vaccinated, get vaccinated. That message has not changed since the vaccines came out. Is it almost frustrating on the point of health officials that people aren't listening?
What you're speaking to is the fatigue, right? It's been a long year and a half for folks. Not everyone's at the same place to make this decision. It's a personal decision. But at the end of the day, all we can do is stay consistent, stay on message. So frustrating, it's tiring to some extent, but we also want to encourage folks. We've seen movement. We've thrown everything at this, the incentives, the pop-up clinics, the drive-through clinics that we have at the Alamo Dome. So we just stay the course.
Okay, let me say one thing. And don't forget that the answer to that question, whether or not you get vaccinated, is about more than just you. Your behavior affects other people's health. And for the first time ever, we have the ability to get young children vaccinated between the ages of 5 and 11. But keep in mind, there are people that are immunocompromised who are not eligible to get the shot. There are children under 5 years old. And then there are people who have underlying health conditions who are, in treatment for something that could be very vulnerable to severe illness. So your choice of whether or not to get vaccinated or protect yourself when you're out and about, and I did the math, Claude, if you were at last week's UTSA game, that means roughly 10,000 people in that building were likely unvaccinated. Think about that. You've got to protect yourself and protect other people at the same time. So when you're answering that question, should I or should not get vaccinated, it's about more than just you. Think about that for the holidays. So Merry Christmas, everybody.
we'll get you the exact